Welcome to Journal Club this week. My name is Camryn.
And I'm Jessie. And for those of you who don't know what Journal Club is an AOTA-inspired program where people research and discuss current literature and evidence-based practices.
And so this week we're going to be talking about, we're going to start a new series on the different OT settings and kind of differentiating and kind of what would you expect in this setting. So this week we're going to talk about acute care versus inpatient rehab.
And I'm going to start us off by talking about acute care. So in acute care, the main focus is medical stability and immediate needs. This happens right after a patient suffers an illness, injury, or has surgery. So the patient population, they're medically complex, they're often unstable, they could have just had a big surgery, and they can also be in the ICU.
So they might have like a lot of lines and tubes that you need to be careful of, and just be aware of what you can and can't unplug.
Right, that's probably the biggest part of it, is knowing what you can and can't do in an acute setting. But the length of stay at an acute setting is short, and it's often just a couple days, so that's where like the acute comes in. The pace is often fast-paced, it's unpredictable. There's a high turnover of patients, so you're seeing a lot of new faces. There's lots of evals and discharges, and the primary focus is on making sure the patient is safe enough to either go home where they can receive outpatient OT or PT, or if they need to progress to the next level of care, which is often inpatient rehab. So the sessions are often short, and the OT's main focus during the session is working on basic self-care, and that could be toileting, grooming, eating, whatever the patient finds to be most important. OT can also work on positioning, bed mobility, energy conservation, and education about all of these things. And the goal is to stabilize the patient and to discharge them. So it's not a long-term skill building type of setting.
That's where the inpatient rehab comes in, is the long-term skill
You're
building.
just trying to get them stable enough to basically leave. Like, you want them to get out. And OT may recommend discharge to any of those scales. But the thing about inpatient rehab is that they only can discharge inpatient rehab if they can withstand 3 hours of therapy per day. So that's kind of what you're working up towards in acute. The environment, there's a lot of collaboration with nurses, doctors, and all of the other teams. And this is because the patient is often medically fragile. So you want to ask or just collaborate with nursing to see if they are able to be seen by OT that day. A big pro that was pointed out is that there's exposure to a wide range of diagnoses. It's fast learning, and it's a very dynamic environment. And a con that was stated is that there's limited time with patients. You're often in and out, so you can't really build like relationships with your patients in this setting.
They might not feel well either in this time.
And they might refuse, and you just have to say, okay, that's fine, we'll come back. There's less follow through. Again, you might not get to see the patient but one time, and it could be for an eval. And it can often feel rushed just because the patient is often needing tests, needing other therapies, so they might not have a lot of time for OT specifically.
So I know you had your field work in an acute care setting. Is this what you experienced?
Definitely. I think like there were 2 patients I saw more than once in the week I was in acute care. So you definitely see a lot of faces, but I think the time we spent in the room was so meaningful because we were often like their first line of contact, like post-surgery. So we got to set them up for the first time, or take them on their first walk, or let them wash their face for the first time after surgery. So it was really cool. But yeah.
We'll be back right after this break.
Okay, we have the Halloween soiree coming up. I'm not sure the date, it's the Thursday before Halloween, so be there, Lumberyard. Also, pickleball tournament, TBD if I'm gonna come take everyone's money, might be there, might be dressed as the Lorax. Break. will be approaching soon.
Fall break.
Fall break. That is this weekend. Have a good time. Love your president.
Oh, hey, I want everyone to come out for the Thornwell Fall Festival every Saturday up until October 25th. It is a super fun time. You get a free t-shirt, free lunch, there's even donuts, and a good sparkling cider. I would love for anyone to come help with the afternoon shift from 12 to 5 if possible. They need more help with that. If you can, show up.
You want to be good? Play like Jackson. You want to be great? Play like me.
Welcome back. We hope you enjoyed our ads. And so now we're going to talk about inpatient rehab.
So inpatient rehab, you might see it also called acute rehab, but this is the facility that's immediately after acute care, like Jessie already said. The only way they can go there is if they were referred from acute care. So the focus of the inpatient rehab stay is going to be recovery and functional independence and getting back to all of the important tasks you have to do that you may not be safe enough to perform at home or independently, depending on your living situation. So the length of stay is going to be longer. It's going to be multiple weeks because these patients are more stable. They're able to do more work more intensely on these IADLs and ADLs, but they also have to be motivated to do so. If they're not motivated to work put in 3 hours or more of work, then they might be discharged from the hospital to a skilled nursing facility or something similar to that.
Because 3 hours of therapy a day, it sounds like a lot, but it's really just trying to get them back to like a livable state, like where they can live independently and like do all the things that they could before their injury or surgery or illness or whatever got them to that point initially.
Exactly. Yep. So the pace is slower, but it's more structured because these are going to be anywhere from 30 to 90-minute sessions, and you're really going to work intensely with certain patients. So you'll get to know your patients a little bit more than you would in the acute care setting.
And it's more structured too, like usually there's, okay, OT's going to come see you at 8 o'clock in the morning. I know in acute care we were kind of like, we'll see whoever we can whenever we can. Like it wasn't like we're gonna go see this guy and then this guy. It was who can we see right now.
When I was shadowing inpatient rehab, they had like designated, you're gonna go in there at 7:45, help them eat their breakfast and help with the independence in that, or you're gonna be in charge of dressing and bathing for the day. Those will normally be like the morning sessions, and then afternoon will be more of the harder, more demanding tasks, I guess.
So I think like looking at it as like a profession, if you're looking at needing that structure and knowing what your day is going to look like, not saying that one's better than the other, but like inpatient can be a little bit more suited for you, or if you like go with the flow, that flexibility is really coming into hand with the acute setting. So I think that's something to keep in mind.
And in treatment, there's an article by Osborne, and they were talking about you might see problem-solving treatments for post-stroke patients. This will use like their metacognitive or like self-awareness or like just being aware of what you're thinking to improve your self-confidence to get through these ADLs and IADLs and be able to problem-solve your way through life, because that's an area that's difficult for this population after strokes. So yeah, patient population. They are medically stable, but they have the significant functional needs, like in strokes or spinal cord injuries or recovering from a major surgery. The environment, it is the interdisciplinary rehab team. So you work really closely with OT, PT, speech, rehab nursing, social work, all of them, because you're trying to collaborate to get them home. So the pros of this environment is going to be building the stronger relationships with your patients. You get to see them progress over time, which personally is my favorite. I really like to see that progression. And then you get to see these meaningful outcomes of them being able to be independent. A con might be it can be physically demanding because you're going to really work on these transferring techniques and developing strong muscle endurance.
And just like the duration of the therapy session is so
Right.
much
It's
heavier and
intense.
longer
Mhm.
that you're going to need to be able to
Mhm.
hang with the patient.
Yeah, so it will be emotionally heavy
Mhm.
at times if a patient might not be progressing as they were expecting, but it's just how you help motivate the client that will be better. And then another con in this is there's a little bit more documentation to handle than
To prove the need to stay
Mhm.
somewhere for, what was it, up to 3 weeks?
yeah, that and like the insurance dilemmas. But other than that, I think inpatient rehab is an excellent place
And
to
I
be
think
an OT.
the reason why we really wanted to do this is it gets confusing because of the overlap of you see the same patients, but it's just at different times in their healing journey. So I think it's important to know what the focus on is in each setting. So that's why we really wanted to talk about it, because I know it was confusing for me, but
Well, I hope you enjoyed our journal club.
thanks.